My name's Olivia. I'm a certified clinical exercise physiologist. And today I'm going to be talking about exercises and stretches for sciatica. Specifically, this is going to be a part of my pregnancy series. However, you can have sciatica whether you have pregnancy or not. It is just irritation of your sciatic nerve, which is located in the lumbar or lower spine region. And it ends in the upper leg, so it can go down your lower back to your hips to your upper thigh. So I'm going to be focusing on stretches and exercises today that can help relieve some of that sciatica pain, especially in pregnancy. As always, before starting new exercises or workout, you should always consult your physician or healthcare provider with any questions or concerns that you have. Please exercise safely and exercise at your own risk. Thanks. So this is the bird dog exercise. You're going to start by taking opposite arm and leg and outreaching before crunching back in towards the center, opposite elbow to knee. I recommend starting with 10 reps on each side, one set, and then going up from there. This is going to work your core, and in turn it's going to stabilize the spine. You can progress this exercise by increasing your repetitions and sets to 10 to 12 repetitions, 2 to 3 sets. Once you feel like you've hit a point where you've increased your reps and sets, you can add weight to this as well. Adding dumbbells, ankle weights, or both. You're going to want to keep the movements nice, slow, and controlled here, with or without weights. The goal is stability, and we're going to build that through a controlled movement. This next exercise is a sideline leg raise. You're going to lie on your side, try to keep your legs straight, and you're going to take that upper leg and go up and down. Again, I recommend starting with 10 reps on each side, one set, and then building up your strength when you're ready by increasing those reps and sets. 10 to 12 reps, 2 to 3 sets before adding a band around the ankles or ankle weights to increase the intensity here. So this is going to work on our hip strength. We call those our abductor muscles. So building up those accessory muscles around that sciatic nerve is going to help lessen the pain and the symptoms. This next exercise is a stretch. I call this a figure 4 stretch. Again, that's going to stretch your hip muscles as well as your glutes. So in a seated position, you can be on a chair or on the ground, on a bed, and you're going to take one leg, place the foot flat on the ground, and then take your other leg, place the ankle right above the knee. You're going to press that knee out. You can also go into a lying or supine position and pull that leg that was planted on the ground back towards your chest for a deeper stretch. I recommend holding each side during the stretch for 30 to 60 seconds, doing anywhere from 1 to 3 sets of this. The longer you hold it, the deeper the stretch. The further up you move your hands and move your upper body towards your legs, the deeper you're going to feel this stretch. So the closer your chest is to those knees, the deeper the stretch is. This next exercise is another stretch. It's a hip flexor stretch. You're going to go into a sort of lunge position. So front foot planted on the ground, back leg is stretched out behind you. The further you lean forward, the deeper the stretch. You can hold for a few seconds and then bring it back, stretching that hamstring as well, and then go back into that front stretch hold. You can also just hold it in that front stretch too for that full 30 to 60 seconds if you're ready for that. The longer you hold it there, the deeper the stretch. I recommend doing anywhere from 1 to 3 sets on each leg. I personally recommend keeping that front knee behind your front toes. It keeps some pressure off the knee and off that joint. Now, if you're comfortable with it, you don't have to. You can go into that deeper stretch and go forward. But for me personally, I'm going to keep that knee behind my toes. This last exercise I call the tabletop stretch. It's going to stretch out that lower back, right where that sciatic nerve begins. You can be on a table, a chair, a bed, or even a wall. You're going to place your hands on whatever stable piece that you are using, and you can walk yourself out, or if you're using a stability ball like myself, roll that ball out in front of you until your back is outstretched. You're going to feel a release of pressure on that lower back. And then you can hold it here for 30 to 60 seconds, 2 to 3 sets. As always, guys, thanks for watching my video. Please like, subscribe, and share if you found this helpful.